So this is the Managing Care 1 lecture for leadership principles, management practices, and also time management and prioritization. It should take approximately about maybe a half hour of your time. Here are your student learning outcomes. Not going to go too much into detail. You can read them all on your own and also on your concept learning modules. These are all outlined there as well. But basically, we're going to talk a lot about leadership versus management and how to manage your nurse. So managing care, the definition, it's required of all nurses because you need to know how to manage the care that you're going to be providing to your patients, and this means organizing tasks that are at hand appropriately, being able to differentiate things that need to be done immediately, things that can be done later on in your shift, and things that maybe don't even have to be done on your shift at all. So managing care is generally required of every single nurse as you're caring for patients. Definitions that you should know are leadership, management, and time management. They're all listed there. I'm not going to read them all for you. And also prioritization, and especially knowing how to differentiate those three different categories that I mentioned a minute ago: things that you need to do now, immediately, things that you can postpone till later, and things that you don't have to do. They do not have high priority. So decision making is the thought process of selecting a logical choice from the available options. So there are many different elements of decision making, right? You really have to think of everything that you have at hand, whether it be a certain problem or just a patient scenario that you have, to make your decisions on how you're going to care for the patient or the situation. So when you are making decisions, you want to be able to define your objectives. You also want to be able to gather all your data that's appropriate for the situation. Take the necessary time. So again, we'll talk more about time management a little bit later on, but allowing yourself adequate time to perform all of your tasks. Also generating alternatives. You know, if this intervention is not going to work, then what is my alternative? And also think logically and choose and act decisively as well. So decision making is a pretty involved process, and sometimes, I don't know if you've ever heard of left brain versus right brain thinkers. It really kind of shows that there is a difference in the way that people think. There are little tests that you can take that are kind of fun to do. I had done a couple of them during graduate school when learning about left brain and right brain thinkers. And it kind of lets you know what side of your brain that you use more. Left brain thinkers are more analytical. They kind of think in a linear pattern. So they may be better at processing like language, numbers, ordering things and prioritizing things. And they're usually good at mathematics, reading, organizing, and planning as well. So that is your left brain thinker. And then you have your right brain thinker, which is more the creative type of person, more intuitive, and they are a little bit better at picking up on things like nonverbal cues. They're more holistic in their care, and they typically tend to have more creative traits, like more into images, colors, patterns, music, things like that. So when I actually did a little test in grad school, I almost came out about 50-50 for left-right brain for me. I was a little bit more left brain than right brain, which was really interesting because I think when I look at myself in terms of just me personally as an individual and then me as a nurse, I can see a lot of these left and right brain qualities. I'm definitely a very good planner. I like to, organize everything and plan everything out. If you asked, my husband, he would call me crazy because everything is organized by color on our planners and calendars at home, and everything's sort of just laid out in terms of work, appointments, everything else. So I'm extremely organized. I would say that I am good at math because you have to sort of be good at math as a nurse. But then I also like to see images. Like I mentioned in the professional behavior lecture, that sometimes the images of things really help to put the piece of the puzzle together for me. So it's quite interesting. If I can find a good little quiz, maybe we can do it during class time, so you guys could all experience that to see if you're left brain or right brain or both. So decision making in a nutshell is required as a nurse. It's important to know how to make decisions and understand the way that you think can play a role in your decision making. Problem solving is pretty straightforward, being able to solve problems, and this basically includes like the nursing process, right? So with problem solving, you would need to identify that there is a problem, and then you're going to have to gather information about that problem, maybe what has caused the problem, what are the consequences of this problem happening. So you gather your data, and then you're going to look at alternative solutions to solving a problem, and also select which solution would be best in this situation for whatever problem it is at hand, and then implement your solution that you've chosen and evaluate your results. So when you look at all of that together, it sounds much like the nursing process, doesn't it? So you have something you need to assess, right? You're assessing a problem at hand. You're going to diagnose it. So why is it happening? What are the consequences? What are the causes, right? You're going to plan, because you're going to think of solutions that could possibly fix the problem at hand. And then you're going to implement whatever plan that you have chosen. And then you're going to evaluate. Okay, so problem solving basically is the nursing process. So you identify a problem and you figure out the best way to solve it. Critical thinking and critical reasoning we have already discussed in professional behavior lecture. But again, they kind of go hand in hand, and a lot of time these days we're starting to hear a lot more about clinical reasoning. So this is just a diagram here to sort of see how you need all of these things together to be able to critically think, right? So you're going to have didactic theory, meaning you're learning in school, right? So you come to class, you listen to your lectures, whatever it may be, you're educating yourself. Personalized learning is how you learn individually. So how do you learn best? Everybody learns a little bit differently, right? Some are visual learners, maybe auditory or kinesthetic, hands-on. Group process is kind of putting it all together and learning how to problem solve. Okay, so it's just sort of a diagram of the skills that you sort of need and experience to build upon your critical thinking skills. There are many different leadership qualities, okay, and these are some leaders here who are pretty well known from history. And a lot of times when you look at these leaders, such as Mother Teresa, Gandhi, Martin Luther King, or John Kennedy, they have a lot of these leadership qualities that are listed here. So they're charismatic, they're dynamic, enthusiastic about what they love, or what their goals are, what they want to achieve, what they're going to change. They're poised, they are confident, and they're self-directed. Okay, so sometimes people get confused with self-directed, and they mistake it for being someone who is selfish. So I just wanted to take a moment to mention that self-directed simply means that they within themselves create, these goals or aspirations that they want to achieve. And their motivation within themselves helps them to achieve that. So self-directed means that drive, that motivation is coming from within themselves to make the change that they want to make, okay? So leaders usually have a vision that helps to sort of energize a group of people and bring forth their best efforts to achieve that vision or goal, okay? They typically really love learning, they're knowledgeable, and they are creative in the way that they develop different resources for, maybe it's staff members on a unit. Remember when we were talking more about organizational programs for nurses. So they're creative and they use resources as they need. And leadership qualities are really potential of all nurses. It's basically anybody can have leadership qualities. So they often are part of an organization, but maybe they are, for instance, not hired within an organization as a leader, but they are hired as a staff nurse, and they work within their unit to really bring together all of the staff on their unit and really collaborate and create like a really great environment of teamwork and support. So that would be someone who is like a leader, okay? They don't necessarily have to have a higher authority within the organization. It may just be a staff nurse that you work for who really tries to empower everybody that they work with to have the best working environment to work in. They really try to promote dignity and respect of patients and establish caring relationships. That's most often important to leaders. And they typically have followers simply because they sort of just cause that empowered feeling in other people to want to sort of jump on board and reach this mission or vision or goal or whatever together as a team. So they really sort of help to facilitate collaboration, and people more or less want to join their sort of mission because they know that it is going to be beneficial to everybody. Skills, you can read them all there. I'm not going to go through them all, but basically they look to strive for excellence. Okay, I mentioned commitment and passionate for one's work. They're very trustworthy, respectful, and empathetic and caring, okay? And if you remember from the professional behavior lecture, I had mentioned that leaders typically really want the best in terms of like lifelong learning and professional and personal growth of other people. So that again is here on the list, as you can see at the bottom. They're responsible to enhance the personal growth of all staff. So that's really an important skill and quality of leaders. They really try to bring out the best in other people. So there are many different leadership styles. This here, authoritarian or autocratic, those two words can be used interchangeably. These are typically found in large bureaucracies such as like the Army or Armed Forces. This is sort of that top-down type leadership, right? So you have someone who is appointed to be the leader, and they're sort of overseeing everybody below them, and they sort of dictate, in a way, what tasks are going to be done, who's going to do what task, and sort of more, I don't want to say like Big Brother, but sort of like watching over people to make sure that this is the way it's done and this is what I say, so this must be done. All right, so authoritarian leadership styles have a really high risk for high staff turnover and burnout because a lot of times staff members feel like they don't have a say, right? They don't have a voice in where they're working, and that over time leads to them feeling burnt out in their job, and they may leave their job because of it. So leadership style, authoritarian or autocratic, really is not the ideal style of leadership in like a workplace, in a unit specifically. Sometimes in instances where it might be used and beneficial to use is if you know that you're a nurse taking care of, say, 3 different patients on a unit, and one of your patients starts to eviscerate their surgical wound and they are starting to bleed excessively, you know that that's a priority that needs immediate attention. So in that instance, you could sort of, be at your patient's bedside and sort of call out orders to the other nurses you're working with that they have to do in this situation. So you might be with your patient at the bedside, but telling the other nurse, go call the surgical resident right now. You have to be a little bit more authoritative and straightforward in a situation like that. So that's an instance where it may be beneficial to use that leadership style, but overall it's generally not recommended just because of the risks for high staff turnover, burnout, and staff members may feel like they're always being controlled by their leader and feel as though they can't communicate or voice any needs that they have or concerns they have on the unit. Okay, they tend to also be more like punitive if they're going to criticize, and that can lead to bringing down some other nurses' self-esteem and everything. So authoritative is more top-down, and as you can see in the little picture there, you have the red person with the big megaphone there sort of barking out their orders for all of these people to sort of stick in line and continue walking like this or continue doing whatever I say, right? You follow my commands. Or participative leadership style. So this is the one that you want, okay? This leadership style is most beneficial to nurses and staff members within organizations. And it allows to sort of let all nurses or staff members have a say or communicate issues that they may have or concerns that they may have. There's a lot more communication between the staff member and the leader in charge. So they really value the nurses' input. It's more of like a teamwork, collaborative environment. They don't really control the staff members that they oversee. They really use sort of like rewards to motivate staff members to participate in, whatever it may be, changes on the unit or updates on the unit, that if they want input about changes that have to be made, they may offer a reward for having staff nurses participate. Their, decision making truly involves the unit or, staff members as a whole, as opposed to the authoritarian where it's top down, the top person is making the decisions only. This here is more teamwork, and it's really beneficial for a unit to utilize. So with this type of leadership style, typically you'll see positive nurse and patient outcomes because the leader is really sort of reinforcing and creating positive relationships between everybody. Okay, so this is the one, if you had to choose, would be the best leadership style. Or non-directive. This is basically a leader who doesn't want to be involved at all. Okay, so it is oftentimes hard to distinguish who the leader may be within a group. They simply have no control over the unit as a whole. They don't really attempt to motivate other staff. They sort of just sit there laid back and don't care what happens in the unit or to staff members. They sort of just sit back and don't facilitate any sort of collaboration or teamwork. It's really just sort of a laid back type leadership style. So it's not very effective for, nurses or, medical units or whatever, just because the task achievement is really difficult when everybody's sort of just working on their own independently and not coming together in any way as a group, as a team, collaboratively to help, make decisions. So this really is not a type of leadership style that you'd like to see as well. To sort of see the differences between the three of them, more so just summarized. So autocratic or authoritarian is do it my way, right? That's the top down. Frequent turnover and burnout oftentimes result because nurses feel like they don't have a say, okay? Democratic is the best. So this is where you foster teamwork and collaboration. And like it says there, let's figure out the best way to do this together. So it's the most effective style, and it's collaborative practice, which is oftentimes what we hear about. We're always talking about working collaboratively with the interdisciplinary team members. And then the laissez-faire is basically laid back, do whatever way you want to do it. It's least effective. There's absolutely no direction from the leader, and nurses kind of just work independently. There's no collaboration, and it's sometimes hard to even distinguish who the leader is. Okay, so those are the three of them. Actional leaders and transformational leaders. You can see here what is sort of qualities of each, but typically a blend of these characteristics is the best type of leader. Okay, so a leader may have some of the transformational leadership qualities, but also have a few of the transactional leader qualities as well. And it's when they're able to sort of blend those qualities that they're most effective as a leader. And then my management skills or characteristics. So management, again, if you remember from the professional behavior lecture, they typically are more by the books. They have tasks at hand that are driven by the organization for which they work, and their sole, goal is to complete the tasks that they have been given. So management characteristics, they're more by the books. They follow the rules. They are motivated to complete their tasks because that is what they have been assigned to do, whereas the leader tends to have goals and desired tasks that they themselves want to do because they know that it will benefit somebody or a group of people, and so on and so forth. Okay? So managers have an assigned position within the formal organization, right? So that could be like your nurse manager. They have a assigned position. They're hired as a manager. They have a legitimate source of power because they are, hired as a manager. That is their job. That is what they are expected to do, is manage other people. They are expected to carry out specific functions, duties, and responsibilities. So just like I was explaining a minute ago. They do typically emphasize some control, decision-making, and decision analysis. But again, not every manager is going to be authoritative and control everybody. They may be able to sort of have a democratic style to their management where they still allow collaboration and teamwork. So don't get confused there where it says emphasize control, because they aren't always necessarily authoritative top down. They also deal with budgets, within a unit or multiple units, and are sort of responsible for all the fiscal planning. They also have greater formal responsibility and accountability simply because they have been hired as a manager to manage X, Y, and Z. They're responsible and accountable for who they oversee. And then they have direct willing and unwilling subordinates. So some people may push back against, managers because maybe they don't agree with what has to be done, so on and so forth. But basically, they are sort of by the books, okay? So is cyclical, as you can see, kind of always ongoing. They are always planning. So this could be developing policies that need to be put in place, or planning their fiscal year, their budgets, okay, and managing all of this planning that takes place. And then organizing would be kind of putting together how they're going to go about carrying out these plans that they have just come up with. So they may decide how they're going to make this change, or how they're going to fit X, Y, and Z into their budget for their unit goals, okay? Staffing, they're responsible for hiring new staff. They typically will interview new candidates. They're also responsible for ensuring that new hires are oriented, so that falls under their responsibility to be sure that that is lined up for them. Also scheduling, oftentimes nurse managers will do the scheduling, but it's kind of different depending where you work, because I know where I work in the ICU, we have a very senior nurse who has been there for close to 40 years, and she's the person who has been appointed to do scheduling. So it doesn't always have to be a manager, but in the general scheme of things, managers oftentimes are those who are doing the scheduling for staff and units. They also then go on to directing. So that basically means that they have to somewhat motivate their staff members to carry out the functions that they are expected to do. They have to manage any conflicts that arise within a unit, delegate and communicate between their staff members that they oversee. Okay, so they sort of direct the way that things are going to play out within a unit per se. And then controlling, so again, coming back to the fiscal planning and responsibilities that they have to control the functions within a unit to stay within a budget, things like that. Quality control, if there are quality improvement projects or something that need to be done within a unit, they may be someone who is responsible for carrying out the quality control and sort of controlling how it's going to be done. Okay, so the management process is cyclical because once they have completed all of those steps, then they sort of go back to start planning about the next thing and etc., right? Because management is sort of like an ongoing process for a unit. A chart for leadership versus management. So these are kind of some actions that you may see between the two that might be slightly different, or qualities that you may see. So again, leadership is basically someone who's innovative and creative on their own. Their motivation is self-directed, meaning that it comes within themselves. They always want to do the right thing for everybody. They focus on the benefit of the people that they are around. Okay. And then management is kind of the opposite. They typically like to do things right. They're by the books, excuse me, meaning that they follow the rules. Okay. They tend to be more status quo and sort of just stick with the plan that they have been handed by maybe their managers above them. They typically don't like to be as innovative and creative as leaders, so that's why they like to sort of, stay low risk, stay status quo. They don't want to disrupt anything that could possibly, upset their managers or, chief nursing officers above them. Okay, so that's the big difference between the two, is that leaderships typically do the right thing for people. They want to benefit all those people around them, and motivation comes within themselves. And management does the right thing by the books or by the rules, because that's the tasks that they have been given, and they are going to stick to the plan that they have been given, maintain status quo, not make any changes, and complete the tasks at hand. Okay, so those are the difference between the managers. So people can have qualities of both leaders and managers. It doesn't have to be only one or the other. Okay, so just be aware of that. And all these statements here on this slide go through to say, that there's sort of a blend of the qualities we have already discussed. So I'm not going to read through all of this, but I would say just to briefly read through it on your own. Obviously, you're not expected to memorize all the details here, but just have a general sense that there is something that is called leader managers, because some people can have those integrated qualities and not strictly just be one or the other. And for time management. So with time management, you really have to sit down and sort of think of, I'll use, say your shift at work for an example. You have to think of your shift and say, this is the allotted time I have. This is my task at hand, or my assignment that I have at hand. And how am I going to organize my shift to complete everything that I have to complete before my shift ends? Okay, so in order to optimize your time management, you really have to prioritize the importance of tasks that you need to complete, right? You have to leave time for managing any crises that may arise, because you don't know during your shift if there's going to be an emergent situation that all of a sudden happens. But you need to leave yourself a little bit of leeway throughout that 8 or 12-hour shift to say, hey, if I get caught up doing something else, I know that later on in the shift, I should have some time between, 4 p.m. and 5 p.m. that I know I can catch up on things if that were the case and I had to do that. You also want to reduce stress. So if you're able to sit down and sort of think about your day, then you're going to feel more comfortable starting your shift. You're not going to feel as stressed and unorganized and, oh my gosh, what am I going to do first? Oh, this patient needs this. How do I do this when this patient needs that? You're able to sort of think forward and think ahead so that you know your shift is going to be okay. You're not going to feel unorganized like you're in chaos, okay? So it will help to reduce your stress if you're able to manage your time. And also thinking outside of work is optimizing time management between your work and your personal time. And that's always super important for everybody. You absolutely have to make time for yourself. And that's something too that I talk a lot about. You'll hear later on this semester when you have completed the semester, we have a mentor program for students who have just graduated and now you're starting to study for the boards. And when I have, my mentees that I keep in touch with after, I always keep in touch and mention it's important to balance the time between your NCLEX prep and time for yourself. Because if you don't take care of yourself, you're not going to be able to put your best efforts into whatever else it is, whether it be studying for your boards or going to work and trying to effectively complete all the tasks at hand and care for patients safely and with quality. Okay, so finding the balance. Time management, you want to plan and establish priorities, like I've mentioned. Highest priority would come first. So that is someone, say for instance, who's having an airway issue. That would be your first priority, right? As opposed to someone who maybe has a laceration in their arm, from a foreign object. So even though a laceration in your arm is somewhat of priority because you don't want them to be exsanguinating or something, an airway problem would come before that. So you have to think of what the priority is of the task at hand. And when you're able to do that, and really it only comes with practice and really sort of being exposed to different situations, that you start to realize, oh, okay, so this makes more sense to put this before that. And, you sort of start to learn. So think of that during your clinical experiences, that when you plan out your day for clinical, you're going to prioritize and put the highest task first every day. Okay, so make that sort of a point that you do in clinical. Look at all your priorities for the day and manage them how you think they should be managed. And if there's ever a time where maybe you're doing a task that really isn't of high priority first, and you're saving that higher priority till later, maybe just because you didn't realize it was such high priority, then that is a sort of like safe environment where your clinical instructor can help you to learn the better way to organize. Okay, so think of that when you're in clinical this semester. And then as you go through your day, you're going to have to reprioritize. So sometimes if you had your day all planned out, you sort of knew what you had to do from hour to hour, but an emergent situation came up at 6 p.m. and now you're behind on your 6 p.m. medications, but you know that 2 patients still need dressing changes that you were planning to do around 7 o'clock, you're going to have to reprioritize and say, okay, well, I need to give the medications that are due to these patients first, and the dressing changes are going to have to be reprioritized and pushed back further into your shift. Okay, so sometimes you have to sort of think about changes that have occurred through your shift and how you're going to reprioritize what your tasks are. Okay, so think about critical thinking. You have to be able to think of the problem at hand or the situation at hand. You have to be able to think of many different situations sort of in the back of your mind to be prepared for the unknown situations and know how you would respond. Okay? So there are many things that waste a lot of time. And these include technology, right? So think of how often maybe you're at home, should be doing some reading for class, but you find yourself caught up on the computer, looking on Facebook, looking on your email or, other social media sites. You're wasting time, right? That time could be utilized a little bit better in order to complete your task at hand, which would be, preparing for lecture or class or clinical, whatever it is. Technology is a huge time waster. Sometimes socializing can be as well. So think of it in a way that if you're working your shift and, you really should be documenting on your patients, yet a, old friend who's a respiratory therapist came to your unit and you haven't seen her or him in a little while, and you catch up. You say, hey, how's it going? You start talking, the holidays and this and that. You end up accidentally wasting time that really could have been utilized to complete your tasks at hand. Overload of paperwork is a huge time waster. When you think of, not so much these days, but in the past where you had, a ton of flow sheets that you had to fill out on all your patients. You had orders that were written by physicians that you had to look through every single one and check off and sign. That took up a lot of your time, okay? Poor filing system, kind of the same thing. Just not being able to find what you need for paperwork or a patient's chart or something right away. I know that within my unit in the ICU, our secretary has done a tremendous job over the last probably couple years now, because we were always having so much trouble finding certain papers that we'd need, like consents or progress notes, whatever it was, telemetry stuff. We were just wasting time looking, where would this be kept? Where could this be found? And so she went through and we got a filing cabinet and everything is in there in alphabetical order. So now when the nurses need something, we simply go to that filing cabinet, open it up, and find in alphabetical order what we need. So poor filing systems can lead to a lot of time wasted trying to search for what you're looking for. And then interruptions, again, that kind of goes hand in hand with socializing. Interruptions with, whether it be your staff member or it could even be a patient's family member. If you're trying to sit down and document on your work and you still haven't eaten any lunch or any dinner and you're trying to get through everything and a family member comes out because they have questions or concerns, you have to stop what you're doing and take care of that interruption that's at hand, okay? So with time wasters, always keep that in the back of your mind and always think of, sort of what you can do to best manage your time, okay? So other examples could be like if you're a visiting nurse, for instance, and you have multiple patients you have to go see at their homes, then you might want to look at the grand scheme of things, say, okay, I have to see Miss Smith today, Mr. Johnson today, and, Mr. Parker tomorrow. So you might manage them in a way that maybe Miss Smith and Johnson live close together and Miss Parker lives further away. So you'd go see the people who are geographically closer because that's going to waste less of your time, right? You go see one patient and then, the next patient's not too far from there. So you're getting as much done in that time that you can, as opposed to driving from, Mrs. Smith who lives, over here, and then you go see Mr. Parker who lives 45 minutes in the opposite direction, but then you realize, oh, I have to go back and see Mr. Johnson who lives over by Miss Smith. So it's sort of just looking at the big picture to organize your time in the best way possible. And some ways that I even try to manage my time in a busy ICU is when I get my patient reports in the morning, I automatically sit down first thing at my desk and look up everything I need to know that I didn't get in report, such as like lab work, chest x-ray results, or CT scans, whatever it is. Quickly overview their most recent vital signs and have everything on my paper so I know everything about my patient before I even go see them. So that way I'm not going to be wasting time later. If a doctor asks me, oh, what was the potassium this morning? What was this morning? I have it right there on my paper or in my mind, and I have that ready to be given. Don't have to waste time looking it up. And then I also try to minimize the amount of time that I'm sort of walking in circles around the unit, getting supplies, getting stuff for bathing or hygiene, getting medications, syringes, IV flushes, whatever it is. I try to do that in the morning as best I can. On a good day, if it's not too busy, I'll sort of bring in the stuff for, bed bath. I'll bring in my morning medications. I'll bring in the thermometer and kind of go all in one trip. So that way everything will be in the patient's room when I need it. I'm not going back and forth wasting time. So those are just some examples. I'm sure you could think of many examples on your own as well, but that's just for a general sense of things. Okay. Is something that we can work on in class, so don't worry about it there. When this lecture used to be completely online, students would have to complete it online and let me see. So we can work on this in class, but think of ways